I've had a really good day today. We have good staff members on, great help. Patients aren't doing too bad up there today, so that's really good to see. So it's been a good day so far. There was more lows in the spring, at least for me personally. We saw a lot of people that were really sick and they were turning very fast. A lot of times I'd get to work and I'd have, I'd come in, I'd get report on my patients, and most of them were face down, laying prone, and everybody was almost maxed out on oxygen. This was in the spring, and it was very hard to come in and see every day. We were always getting there early to get a head start because there was so much that you wanted to know about the patient in case anything changed. And like I said, a lot of us, most of the patients up there were very, very sick. And as opposed to now, we have a lot of patients that are admitted because they're very sick, but they don't turn. We were able to keep them before they get worse. We have a lot more meds now that we can give people that are really helping, and that's really good to see. It doesn't mean that our lows aren't just as low. I lost a patient yesterday, and it was really hard. And because of the visitor policies, which are necessary, family wasn't able to be there with them, but we are. So in a sense, you can feel good about that, but at the same time, you feel very bad for the family because they weren't able to say goodbye before they passed. But people are still dying. Everybody is really sick still. Even though we have therapies, it doesn't always take care of everybody. COVID doesn't discriminate. You don't have to have pre-existing conditions for it to attack you differently. It's wild.
I've actually only been a nurse since June. I had been working with UnityPoint it'll be my 3-year anniversary this coming week. I started as a tech, and then once I graduated nursing school, then I started here once I passed boards as well as a nurse. Coming in as a brand new nurse in the middle of a pandemic was something like I never expected. We weren't really, taught anything like that in nursing school. You don't ever think something like that's gonna happen. So just having to learn with all the other nurses that have been here for years, it's been a really big eye-opener, and it's honestly made me more of a critical thinker and trying to expand my nursing skills. I've never felt like I was confident with my skills and stuff like that, but then all my coworkers are amazing. I couldn't do my job without them. So just knowing that I was able to help others with the help of my coworkers. So I don't know. And they were telling me with their routines and stuff, now we have to put on all the PPE and stuff like that. So it definitely takes more time to do it, but it's something that protects both us and other patients, and hopefully help bring COVID down. We always say and it's not meant in a bad way, but we always say we're struggling together. We just kind of all have each other's backs, and I can always depend on all my coworkers. I love the floor that I'm on because of my coworkers. They're amazing.
This year has been so hard, I think, for all of my colleagues and all of my nursing friends to get through. And I don't know that there's a specific way that I could say that I'm coping because this is so difficult. And it's unhealthy, but I think a lot of us are compartmentalizing our feelings to get through this, I don't have COVID, so I can help somebody get through it, and it's just important for me to set it aside and show up and be there for those people. And I know it is for all of our colleagues at Mercy. There's the obvious. When I get to work, before I can even get on the unit and see my assignment, I have to put a gown on. I put my N95 on and a face mask over that. I have to wear goggles and a face shield and gloves. And once I put that on and cross the red line, I am dirty and I can't leave the unit. So everything I touch on that side is dirty, and we have people that run and get us all of our supplies that are clean runners, just to help stop kind of the spread of it. But just crossing that line is like, you have to take a deep breath, and you're going to see sick people. A lot of times more sick of people than you've seen in any other area that you're used to working in. So you get there, I get my assignment, and more than anything, you're looking at how are they breathing, how is their lung function. On medical, where I usually work, there's a vast array of different things that people are there for. But the big thing for COVID is obviously the lung function. So you want to know how much oxygen your patients are on and what we're doing to titrate down, or we want to look at their labs, their ABGs, and see where they're at. Their PO2, that's a real big one. That's really what we look at before we can titrate anybody. And we have excellent doctors, and they do their research, and we're really working together just to try to save lung function. I miss being able to comfortably see my family. That is probably the hardest thing. My dad had COVID. Luckily, he's pretty healthy. He got through it okay. There's no residual effects as far as that goes for him. My sister had it, and she's okay. She's a college student. But I always worry that my grandparents are going to get it, and who knows if they're going to be the lucky ones that get through it. And that's the biggest thing, is you just don't know. It's not all just old people. It's not all just the older population. A lot of it is middle-aged people, and my parents are middle-aged. I don't want them to get sick. I never know. It's tricky, and you fear for your family. So everything you do is very cautious. I wear my mask everywhere. My husband and I, him too, he wears his mask everywhere, and we just limit leaving the house. And that's the biggest thing, I think.
Honestly, today it was a pretty good day, and it's nice to actually have a good day where you're not having, we don't mind taking the critical patients. We love taking care of them, but it's nice to have patients that you don't feel like they're gonna crash on you and stuff like that. That makes for a really stressful day, but it's something that we still do. We enjoy doing that and stuff like that. But honestly, just being around my coworkers today, I was really nervous coming in today because it was my first day as charge, but everybody was really reassuring and told me I was doing a great job. So that really helped me feel like I was doing a good job, and hearing that reassurance and stuff like that.
What is something that you miss about pre-pandemic life?
Not wearing masks. That would be nice if we couldn't, but that is the only thing that's really going to help us at this point. So please, please, please wear your mask. So if we have someone that's a really high fall risk patient, so if they are just older, they're really confused, or their medical condition makes them a higher fall risk where they're more susceptible to injuring themselves or just being really impulsive with getting out of bed and it's not safe. It's hard if they're also in a isolation room, because you have to gown up 100% to go in there when it's almost kind of an emergency situation, because they might hurt themselves if you're not in there to quickly get them. So, and if there's a code or any other emergency throughout the hospital, you have to make sure you have your gear with you. And if you're in your patient's room and you're on the code team and you got to go all the way down to the ER, you still have to find all of your gear, grab it, and get down there. So it just kind of delays time, but patients have been pretty understanding about that, and we are really grateful for that. Nobody wants to be in the hospital, so it's been a really good balance of really helping them get out when they really are wanting to go. And honestly, it's just, I don't know, it's really different having to gown up every single time.
The busiest time would probably be between 7 a.m. and about lunchtime, which is usually about 12:30. That's the busiest time. It's the hardest time because we're gowned up and we are so hot under all of our PPE, and we don't get to take it off. And for me, and I know I'm speaking for my other colleagues as well, our patients come first for a lot of things. I can't take my stuff off to go cool off if my patient can't breathe. That's my priority. So you sweat through it, you get through it, and then you take your break, you know. If they're minor things, you know, you do need to take care of yourself, but we really strive to put our patients first.
If it's a bad shift, then the drive home for me, I just kind of like sit in silence and kind of like let it all come in. But during the day, it's honestly it's very, very fast paced on our floor. We're doing 100 things at once. So I wouldn't say there's necessarily like a hard time or something. It's just always very fast paced and really quick. So honestly, sometimes that drive home, it can like, you kind of think like, oh, what could I have done to, you know, make my patient's day better? Like even if they have no complaints of their care, like just as nurses and healthcare professionals, like our techs do this and everything, everybody just, we want good patient outcomes and good patient experiences. So even if you feel like you did like a great job, you still always wonder, oh, I wish I could have done a little more for them. But it's tough, but we love doing it. When you're in the hospital, it's not just doctors taking care of you, it's an entire team of professionals that are doing it. I wish other departments would get the recognition that they deserve. We couldn't run a hospital without, you know, everybody doing their part. So, you know, people just assuming that someone taking care of them is just the doctor or doing stuff like that is just the doctor, but it's all sorts of individuals together. So, and then just, I don't know, I kind of hope it opens the eyes of like what nurses do and techs do, every single person does that's involved in their care.
There are a lot of times now where I drive home with nothing on the radio and just sit and try to like, okay, like replay the day kind of, and I always like to tell, like especially new grads, when you leave this hospital, leave it at the door. Don't take it home, because if you do, you won't sleep, you won't eat, and it'll just wreck you. So you have to learn to trust your colleagues, and I think we've got great colleagues here. We have excellent travelers. Like, I know when I leave at the end of the day, I can hand off to the next nurse and know that my patients are in good hands. So leaving here, listening to just nothing is kind of a debriefing, just kind of breathing and just getting through, you know, what you witnessed and what you got through during the day is probably the biggest thing I didn't really do before. Because when I used to, before this pandemic, I could leave work and be happy with the day I had. Even if it was a bad day, I didn't leave until the job was done. And I know I handed off my patients to great nurses who easily could take care of it. Where now you just never know if a patient could change after you hand off, and you come back the next day and they might not be there. And that happens. And you just never know when it will. So it's surprising.
What would you like historians to remember about this time in history?
How strong our medical staff was and had to be when they weren't ready. That's the biggest thing. I've got wonderful coworkers, and we've been through a lot this year, and you know, I just think that deserves to be remembered. Wearing your mask and social distancing and limiting exposure to people who are positive or going to the store, anything like that, it makes a difference. It truly does. And that's the biggest thing I basically ask, is that people are conscious about what they do and where they go and who they're around, especially now more than any other time, because, you know, with the holidays, people are going to be getting together for Christmas, and it's hard for people not to, but it's I don't know. It's just hard, because I think there will be there could be a really big spike after Christmas, and I wouldn't be too surprised. But I guess I would just ask that people think about others, and anything you can do over FaceTime or Zoom or anything like that, do, because it does help.